Archana Bindra, and you just heard me talk about Diabetes 101. I'm now here to walk you through the next set of slides, which is on the why of lifestyle medicine, SMART goals, and exercise. Why would we be too concerned about lifestyle medicine? Why now? I mean, there is a chronic disease epidemic. We all know that poor diet is linked to death, to disability, and these are found globally. The top killers that are related to poor lifestyle behaviors is heart disease, strokes, diabetes, and cancer. And more than half of the US population at least has one of these conditions. You would believe it or not, but 6 in 10 adults in the US have a chronic disease and 4 in 10 have 2 or more. So they either have heart disease and diabetes, or they'll have some kind of combination of one of these mentioned below. So it's very important that we attack this in order to prevent any of these from taking over our life and not allowing us to lead a very fulfilled life. It's a very simple, powerful therapy. We look at 6 different aspects. The first one is nutrition, there's sleep, there's exercise, substance abuse, stress management, and healthy relationships. Nutrition, we will talk about much more in depth later. There will be a topic on sleep as well. But today we will cover exercise, and all of the other 3 will be covered in later topics. So how does one know that they are ready to change? Well, as physicians that you would go to, they follow something called a trans theoretical model of change. And what they look at that is whether you're at what stage in life are you ready for? Are you in a pre-contemplation, like you're just sort of thinking about, you need awareness, why you need to change? Why is it important for you to make the change? Are you past that stage and now you're sort of contemplating what are the pros for my change or what are the cons for my change? Would it help me? Would it not help me? Or you might be in the preparation phase where you're going to commit yourself and come up with a plan and do something about it. Or you have moved even forward and now you're in the action phase where you're actually implementing your plan and you're going to revise your plan and you're going to carry it out. But the hardest phase is the maintenance phase, and that is integrating that into your lifestyle. So we're going to talk a little bit about how do we achieve that. So it's very important to always have SMART goals. And the word SMART is an acronym. It's for S is for specific. So what do you want to achieve in your area of focus? You want to ask specific questions. You want to ask the question of how, why, what, where, when, very specific questions. So you have to have well-written goals. Is it meaningful to you? Is it measurable to you? That's another one. So you can't improve unless you measure something that's that you can quantify. And is it action-oriented? What are you going to do to achieve it? It's also, is it not just action-oriented, but is it attainable? Is it achievable to you? It has to be challenging, but not the impossible. Is it realistic? Is it relevant to you? That's another question. And then finally, you have to have a timeline for it. You have to have a completion date that holds you to being accountable for it. So a good example of this is that you're going to say, you're not going to just say, I'm going to go for a walk. You're going to say, I'm going to go for a walk at a park close to my home. And how do you measure it? You're going to say, I will walk for 20 minutes. And how do you know that it's attainable or achievable? And how are you going to carry it out? Because you think, okay, my husband will go and pick up our grandchildren or children from school, and that will help me go for my walk. And how is it relevant? Because if I go for my walk, then it will help me control my blood sugars. And how do I know in what kind of time frame am I going to do this? I will walk 3 times a week, Monday, Wednesday, and Friday at 5 p.m. And I will walk maybe with my neighbor, if you want to make that easier. When we're talking so the SMART goals are very important as to achieve what one has desired to achieve. Now we will talk about physical activity and exercise. So any bodily movement that's produced by contraction of a skeletal muscle that increases body energy expenditure above a basal level is essentially physical activity. And exercise, when we say the word exercise, it's a very loose word. And what it actually means is there's four components of it. There's aerobic exercise, as in endurance exercises like cardio. There's strength training exercises or resistance exercises. Then there's flexibility exercises, and then there's balance. And physical activity has been known to lower heart disease, blood pressure, diabetes, breast and colon cancer, depression, falling. Falling risks lower substantially when you exercise, and metabolic syndrome. Physical activity also improves your quality of life. It makes you more active. It gives you better cognitive function. It makes your brain work better. It improves your sleep. You get tired. You get good sleep at night. It improves bone health. It's very important because you don't have the risk of developing osteoporosis later on. And exercise versus medications. A lot of people ask, should I take a medication should I just exercise and maybe I won't have to take anything at all? So exercise does have significant reduction on your systolic blood pressure, which is very important. 340,000 patients that were looked at, and they found out that exercise and many drug interventions basically had very similar mortality benefits. Exercise was as effective as any kind of medication for blood pressure. So why take a medication when you can exercise? But that doesn't mean that if your blood pressure is high enough, you would not be taking a medication. You may still require it. So what are the minimum and maximum levels of exercise? So any amount is better than none, definitely. When you stand for 2 hours a day, there's a 10% decrease in this, what we call all-cause mortality. When you're standing for 5 to 8 hours a day, you have a 15% decrease. And when you stand for more than 8 hours a day, it's a 24% decrease in all-cause mortality. So it has been realized that when people are at work, they actually advise them to stand. There are lots of tables nowadays that actually can be raised so people can stand at work instead of sitting at a desk all day. So your 2018 physical activity guidelines, and I think they haven't really changed very much after that, tells you that regular physical activity reduces the risk of many health outcomes. And when you want to do the most health benefits are when you walk or exercise for 150 minutes a week. It might sound a lot, but it's actually 30 minutes a day. And that's of moderate intensity activity, like a brisk walk, or 75 minutes of extreme intensity, where you might be going for a run. More the physical activity, better it is. There's no real threshold that needs to be achieved before you see a benefit. And vigorous gives you some kind of modest additional benefits. But if you're not able to do that, and if you can just do 150 minutes a week of moderate intensity exercise, like a brisk walk, 30 minutes a day, that would be extremely beneficial. So aerobic exercise guidelines. So from the age of 18 to 64, they recommend 150 minutes of moderate intensity aerobic activity, or 75 minutes per week of vigorous intensity, or both. For additional benefits, you could do 300 minutes of moderate intensity or 150 minutes of vigorous activity. So any additional benefits are gained beyond this amount. For children, they always recommend that they should stay active throughout the day. If they're between the ages of 6 and 17, with all the new screen times and homework, etc., it's recommended that they get at least 60 minutes every day. So what about strength training? So the American College of Sports Medicine recommends that you would want to do strength training that should be performed on a minimum of 2 non-consecutive days of the week. So you don't want to do it on Tuesday and Wednesday, but you want to skip a day, with one set of 8 to 12 repetitions for healthy adults, or 10 to 15 repetitions for older and frail. So what are the guidelines? You want to start slow. You gradually increase the intensity of your workouts. You never want to strength train the same part of the body on consecutive days, because otherwise that will cause fatigue. You always want to maintain a proper form and technique, because otherwise you might end up with injuries. And the last few repetitions should be at the point where you're finding it difficult to lift while maintaining a proper form. So you're actually going into fatigue, and that's when you know that, okay, you've had enough. So most important is that do not do it on 2 consecutive days. You want to do it on 2 non-consecutive days of the week. So falls are extremely common in people who are over 60 years of age. And it's very, very important that one exercises in order to prevent these falls, because then they have their own limitations. They cause people to get bedridden, and then that leads to a whole load of other complications. So exercise itself, 37%, there's a decrease in injurious falls. There's a 30% decrease in falls resulting in medical care. There's a 43% decrease in severe injury, and there's a 61% decrease in fractures. And a lot of that is related to in menopause for women. The lack of estrogen causes an increase in osteoporosis and an increase in fractures. And lack of balance, if you don't exercise regularly, the risk of those fractures increase due to the risk of falls. Now, all of this has to be extremely a sustainable behavior change. So whatever you want to incorporate has to be able to be done on a daily basis. And some people need self-monitoring. You could buy a pedometer, you could buy a Fitbit, you could buy something that makes you count the number of steps you take. It also you might be in a situation where you relapse and you may stop doing it. It's important to maybe be part of some kind of a team of people who you meet and you regularly exercise with. You could have a health coach, you could have a trainer. These kind of people keep you on your feet, they keep you sustained, and they sort of have a timetable for you. There are wellness programs like Crack the Wellness Code, which will also help. There are fitness centers, there are health clubs. So it all depends on how you are as a person and how you like to work. Now, if we're talking in terms of exercise and weight, then you have to walk at least 150 minutes per week. It will help you lose at least 2 to 3 kilos. If we're talking in terms of more than that, then you have greater weight loss. Strength training, resistance activities, at least 2 times a week. So it's very important that please make lifestyle medicine with SMART goals and exercise your companion for life.
Thank you, Dr. Archana, for enlightening us on the important aspects of lifestyle medicine, smart goals, and exercises. We hope our viewers have enjoyed and embraced this segment as much as we have enjoyed presenting it to you all. Now, let's move on to the next segment of the course where Dr. Soham will talk about basics of plant-based diet and sleep hygiene. We wish all the participants good luck and encourage you to watch all the videos for a comprehensive understanding of all the topics and engaging in the activities provided in the course. Happy viewing!